that 80% statistic to me of significant economic impact from the disease is astounding. And that's not just in countries in the global south, it's in countries in the global north as well, including, Canada, the United States, England, and so on.
Okay, hi, I'm Xian Xiao.
And I'm Dr. Sammy Winemaker. Welcome to the Waiting Room Revolution podcast.
This season, we are featuring community educators and global champions of the Waiting Room Revolution. And today, we're excited to have Catherine Cummings on our show. She is the CEO of the International Alliance of ALS and Motor Neuron Disease Associations. So welcome to the show, Kathy.
Thank you very much, Stan.
Welcome.
Well, I think we can start maybe with you telling the audience a little bit about what is ALS and motor neuron disease. I'm not sure it's such a common disease that people really understand. So can you tell us a little bit about them?
Sure. And we've been really helped in the ALS M&D community by the fact that the Ice Bucket Challenge happened in 2014.
Yes.
So a lot of people are aware of the acronym ALS or M&D, motor neuron disease, around the world, but not everybody knows what it is. It is a fatal neuromuscular disease. Most people that are diagnosed live from 2 to 5 years. There are outliers that are, of course, longer and shorter, but the average is 2.5 years. And I'm sorry, just my phone went off. You'll have to cut that out on your podcast. And so ALS is a progressive disease, and ultimately the individual ends up typically totally paralyzed and trapped is a word that I would use within their body, and passes away from the disease. Dr. Winemaker, you probably have a better description of ALS from your years of practice. But that's my description from both my personal and professional experience.
Yeah, I mean, there's nothing to correct about that. Just that although there are some common milestones along the way of that illness, that there is, individual variation in terms of what types of losses and in what order the person experiences over the course of their illness. But yes, it certainly is progressive and ultimately life-limiting.
And I think that that's a very important piece, what you just said in terms of the heterogeneity of the disease. And again, speaking from both personal and professional experience, many people, somewhere around 30%, start with bulbar onset in the mouth and swallowing and so on, and the rest start with limb onset. And so that's why it's a very difficult disease for doctors to diagnose as well, because the beginnings of the symptoms that people have don't look the same in any one person. And so it's a process of elimination before someone gets to a diagnosis.
Yeah, that is so true. I also have both personal and professional experience as well. My father-in-law passed away of ALS quite some time ago.
Sorry.
Yeah, and so yeah, when I meet people with ALS, I have such an appreciation for usually before they end up with their diagnosis, they have spent 1 or 2 or 3 years being investigated for strokes or heart disease or, and other neurological illnesses. And it sort of like becomes a diagnosis of exclusion when it becomes very obvious or they end up having an EMG.
And many people, and I'm sorry, Cian, you probably have many questions that you want to ask, and we've gone off on a tangent here. But many people often have surgery for things like a pinched nerve or something like that before they're actually diagnosed with ALS, because the doctor has misdiagnosed what is causing them to limp or have foot drop or something like that. So it's unfortunate that the diagnosis often takes a long time. It is something we're working on at the international level.
Yeah.
Beginning next year to try and shorten the diagnosis period.
You know, sorry, just one more comment then, Sian. The significance of that is that this is, depending on how you look at it, a relatively short illness course, being that it's 2 to 5 years. And if it takes 2 to 3 years for, to get diagnosed, we really do steal away a person's time because they can't acknowledge what the illness is. And so then they spend all this time being investigated when really perhaps they would spend their precious time doing other things and focusing on other areas. So that's good that they're working on faster diagnosis. Anyway, Sian, sorry, I know you have something to say.
Well, no, I just wanted to probe deeper, Kathy, because you mentioned you sort of on the personal side, and if you're open to sharing, I'd love to hear a little bit more about your personal experience with facing this illness.
Absolutely. And I came to this illness totally naive. Well, maybe not totally naive. I did have some friends who had some experience with the disease. And my mom was diagnosed with ALS in 2000. She had bulbar onset. So we knew there was something seriously wrong because her voice had changed considerably and her speech patterns had changed. And she was having a little bit of trouble swallowing already when she received the diagnosis. And my mom was 72 years old when she passed. So she was in her late 60s when she was diagnosed. So we thought maybe she had a stroke or something because her speech was impacted. And so, just armchair doctors, we were worried that she had, some small strokes or something. And so we were completely taken off guard, I would say, when we heard the diagnosis. And I immediately called a friend of mine whose mother had also passed from ALS a few years before, and she gave me the straight goods, which was wonderful. So my mom lived with ALS for 5 years, ultimately passing away in 2005. And if there's such a thing as a silver lining in ALS, I think my mom's story was a very good one. And because I've become so involved with ALS on the professional side from 2005 on, I know that there are, lots of people whose experience is not the same as my mother's. And so I'm happy to share more about that because I think it relates to the theme of this podcast. And we stumbled onto some resources that were super helpful to us. And we didn't know it at the time, but they fit within the structure of hope for the best, plan for the rest. And so that's why I'm such a big believer in both your book and also the waiting room revolution, because I think if people are empowered to be proactive, it'll make a huge difference in their journey.
Yeah. That's the key, right? Being proactive, because in most progressive illnesses, people find themselves being very reactive, right? And everything feels like a crisis, even when some of the changes are quite expected and normal. If you don't know what this illness looks like and what to expect and be prepared, then of course you're just going to think it's one big crisis after another. So I am comforted by the fact that you acknowledge that there was a silver lining to your mom's decline, because I think I don't know how to say this without sounding odd, but I see tons of silver linings when I'm caring for patients with progressive illness. Even though there is such sadness and loss, there is often a lot of beauty and love and moments and strength and bravery. Those are the silver linings sometimes they don't get the spotlight.
Mm.
Can I shine a spotlight on something
Yes.
that to me is huge in what you just said? So after my mom passed, I saw this contest for it was through some insurance company, and it was about, highlighting the impact of caregivers. And so when my mom was diagnosed, my dad was a retired civil servant. He was the deputy minister of Ontario Tourism for a number of
Mm.
years.
Mm-hmm.
And as a retired bureaucrat, if you had asked any of his five children before my mom got sick, could my dad be a caregiver? This is a man who never touched a typewriter, always had an administrator,
Mm-hmm.
that kind of thing. And we would have all said, no, he could not be a caregiver. But he
Mm-hmm.
was amazing.
Yeah.
He stepped up to the plate in such a big way. And when I say my mom's experience was a bit of a silver lining, it was totally because of my dad.
Mm-hmm.
She was never bedridden.
Mm-hmm.
In all 5 years, he made
Mm-hmm.
sure that she got up and was sitting in a chair, could look at the trees out the window every single
Mm-hmm.
day. And he was fantastic at
Mm-hmm.
organizing all her care so that she always had the right care at the right time.
Mm-hmm.
And but every night he left her room at 8:30 and turned the light off and said, "Good night, sweetheart. I love you." And just it was amazing to see this, lifelong bureaucrat transform into this amazing caregiver.
Mm-hmm. Mm-hmm. And it is a caregiver story, isn't it?
Yeah.
Hmm.
As much as it is a patient story.
Yeah.
Hmm.
I
I
love
was
that.
Yeah, I was gonna ask. I mean, it sort of speaks to the resilience and sort of knowing, you can do that if you know what you're preparing for or what to expect. But you did sort of mention a bit about some other stories that you've heard in your work where it didn't go so well. And so did have this question of the challenges for the family, because I think um we may not appreciate sort of like how difficult it is, or what the impact is when we're sort of just going along on that conveyor belt.
Yeah, the impacts are huge, and they're multifaceted. So, just looking at the impact of someone here in Canada who, gets to go to a clinic regularly every 3 months. It's hard to get to a clinic sometimes when you have ALS. And, I'll again use my personal story as an example. My parents lived in Richmond Hill, but their clinic was at Sunnybrook in Toronto. So,
Mm-hmm.
that crosses a border. As soon as you cross Steeles Avenue, you're on two different transportation systems if you need help with disability transport, for example. So
Mm-hmm.
there's lots of challenges in that respect. There's also financial challenges. As you know, I work for the International Alliance of ALS M&D Associations, and we do some global research around the fundamental rights of people living with ALS and MND. And one of the questions we ask about is the economic impact of ALS. And it's huge. More than 80% of respondents to our survey globally,
Mm-hmm.
and we have over 2,000 respondents, say that the impact to them is significant in terms of economic impact. And even when I first joined the board of ALS Ontario back in 2005, that was a discussion that was happening then, was that ALS was a disease that puts people in poverty because the person with ALS often has to quit their job because they can't be productive anymore, but their caregiver also has to quit their job because they need to be a full-time caregiver. So that 80% statistic to me of significant economic impact from the disease is astounding. And that's not just in countries in the global south, it's in countries in the global north as well, including, Canada, the United States, England, and so on.
Mm-hmm.
How many countries are in the alliance, by the way?
We have 65 members in
Wow.
40 countries. And so we
Wow.
do cover a lot of the globe. The area where we don't have a lot of members is Africa. We only have two members on the continent of Africa, and that's not because there are organizations that don't want to join, it's because there are no organizations there to join. We are an organization of organizations, not individual members. And so organizations that are in our memberships are things like, MND Australia or ALS Netherlands or ALS Canada, for example. So, the fact that there are no organizations in Africa, we still try and serve the community there, but we don't have organizations that are members there.
I mean, that's a huge reach. Yeah.
I can just imagine that in addition to the heterogeneity between people, having ALS in one country versus another country would be vastly different
Absolutely.
for patient and caregiver. Yeah.
If you think about it as an index of, if everything that makes up the disease journey in terms of meeting the patient need is things like, economics, legislation around discrimination, access to treatments, access to healthcare, all of the different pieces that someone has to interact with at a system level and a local level, it is vastly different. And that's what our fundamental rights survey that I referenced before tells us, that there are certain factors that influence how someone is able to travel through their diagnosis and their journey through ALS, is really dependent on things like availability of information and resources in a language of their choice, their healthcare system, their access to treatments, their access to clinical trials. And there are certain things that drive satisfaction with this. Satisfaction might not be the right word, but if people think they have access to the highest quality care, we know what those relationships are. So, for example, multidisciplinary care is the standard of care in most healthcare systems in the global north. And so if I look at it through a Canadian lens, there are a number of fantastic multidisciplinary care clinics in Canada that people have access to. And we know through research that multidisciplinary care improves quality of life and ultimately quantity of life, because if somebody has good quality of life, they are likely to live longer. So multidisciplinary care is a key factor in caring for someone with ALS. And, again, using the Canadian lens, we have access to that here. But there are many countries where there are no such thing as ALS M&D clinics. And there might not even be a neurologist that's seen someone with ALS in a local community. I was recently at a meeting last year in Kuala Lumpur, and I was chatting with a neurologist from India, and she was saying that even though the population of India is, in the billions, there are 2,400 neurologists.
Wow. Wow.
One of the things that I'm struck by, and I think it's more obvious with the ALS population, is the emphasis on clinic-based care. And most people with ALS, the majority, will end up at a point in their illness journey when they cannot make it to the clinic anymore. And so I hope that there's some advocacy going on, that the multidisciplinary team approach is beyond the clinic and extends into the community, because when I reflect on people here, it's spotty who will come out of the clinic. And I think that it is not just to expect a certain quality of care only if you can physically get to a clinic. And so home care needs to ante up, and
Absolutely.
the family can't be the only team that is caring for someone in the community. And so we can't go from like the golden tower to, the have-nots in the community.
Absolutely. And the pandemic helped a little bit in that
Yeah.
regard. Again, to use the phrase silver lining, I think a silver lining of the pandemic helped show what could be done by telehealth
By video.
versus going to the clinic. So we had we have what we call a PALS and CALS advisory council, and that stands for people living with ALS and their caregivers or community. And we had an individual in California who was on our PALS and CALS advisory council starting in 2019, and he never went to a support group or anything that was helpful to him outside of the clinic, because it took him, even though it was right in his city, and if he didn't have ALS, it would take him about 20 minutes to get to his clinic. He said it took him about 2 hours to get ready and to go, and then he needed special transportation and so on. And so he said, I would never go to a support group because I can't, I can't put that burden on my family to get me ready to go, whatever. And so as soon as the pandemic came and everything was on Zoom, he said, I avail myself of all sorts of supports in the community now because I can get to them. They're accessible for me. And you're absolutely right that the clinic may be the gold standard, and having all the multidisciplinary team in one place is helpful from an efficiency point of view. It might not be the most effective, though, for our community. And we really do have to amp up on home-based supports.
Yeah. I wanted to follow up because, that sounds like some of the exciting things that are happening. And we met, Kathy, because Sammy and I were giving a talk in Toronto, and you were in the audience, and you came up after and saying, I think there's applicability of the 7 keys. So you kind of alluded earlier to sort of say that in your story or in some of the stories you hear, the keys are happening or not happening. And I just wanted to probe a bit deeper. I mean, do you think the revolution, how does that apply to ALS MND?
So I'll start with my personal story and how it relates, and then why I think it should be embedded everywhere at the global level. So I alluded in my personal story to the fact that we were lucky, and the reason we were lucky was that I have a good friend who's a palliative care nurse. And so I had talked to her a couple of times about when we were at certain inflection points with my mom's journey. And so, for example, when my mother had a feeding tube put in, I gave my friend a call and I said, my mom's getting a feeding tube and we're probably going to need some more support in terms of personal service workers. And she was very proactive in saying, oh, no, you're actually going to need nursing help, that personal service workers can't work with feeding tubes. And she said, these are the things you're going to have to think about for the next few months. So embedding that proactivity, even just from that one conversation, was super helpful to us. And we actually had a benchmark. Strangely, my parents' next door neighbor also had ALS at the same time as my mother. And they were the opposite situation to us in that whenever they asked for help, it was always too late. And by the time they got help for certain things, like there was an example where they had asked for a specific kind of help, and literally they got the call back the week after the person died. And so that's such a tragic situation. And our silver lining was I didn't have a lot of conversations with this friend who was a palliative care nurse, but it was her approach of proactivity and asking the right questions at the right time that really helped us a lot. And so I didn't really have a framework to think about that other than, I was very grateful that she had set us up for success until I read your book. And when I read your book, or actually even when I heard you speak for the first time before I read your book, suddenly the framework snapped into place. And that's why I think there's such applicability in ALS. We need to embed palliative care principles into the standard of care for ALS MND globally. There's no difference, as you've already alluded to, Dr. Wanamaker, of someone having ALS in Malaysia needs to also be empowered to ask these
Mm-hmm.
questions
Mm-hmm.
about, zooming out. What does
Yeah.
this roadmap look like for me?
Mm-hmm.
It's the same for someone in Malaysia as it is for
Mm-hmm.
someone in England or here in Canada.
Yeah.
Yeah, it's just I love your framework. I think that all the lessons are applicable in the ALS M&D community, and
Mm-hmm.
quite frankly, in many other ways as well.
Mm-hmm.
And I would share that right now I'm going through kind of 2 or 3 other health related journeys not related to ALS. I have a
Mm-hmm.
95-year-old father
Mm-hmm.
who spent 2 weeks in the hospital with sepsis in July.
Mm-hmm.
And so we're dealing with his care at this point. And I have a sister who has pancreatic cancer. And so your book has been super helpful in
Mm-hmm.
both of those journeys as well, in
Mm-hmm.
terms of I gave the book to my sister right away
Mm-hmm.
when she was diagnosed, and I hear your words coming out on meetings with her doctor, where she
Mm-hmm.
says, things like, "Can you tell me what the next 3 months are going to look like so
Yeah.
that I can prepare myself for them?"
Mm-hmm. It's so, well, first of all, it seems unfair in some families, the total burden of health issues that are being faced at any one time. So I just want to acknowledge that that's heavy.
Mm-hmm.
You've got a lot going on in your family. And it just it just shocks me that such straightforward, simple information can be so impactful for people. Just that this is such an easy, simple solution, really, when you think about it, to help turn the course of an illness into one that is more manageable, that people feel more in control, that they feel like, you know, eh, that they can get a handle on it. Um, it's sort of upsetting in a way because, had we not done this work, we would have just continued. Every single person stepping foot onto the conveyor belt of some kind of progressive illness would have been set up for such a rocky road.
Mm-hmm.
So we're so grateful, Kathy, that you have seen our work, that you have, digested it and spread it, and you see a place for it. And it's so satisfying for us to break out of the echo chamber of, you know, the cancer mold, even though that's important. But, to have another illness group acknowledge this work is for us like one signal further that we're going to keep going because of people
Mm-hmm.
like Kathy.
Yeah.
I just see it as so helpful to every single person in our community. If
Yeah.
they're empowered to ask the right questions, as you say, as they step on the conveyor belt, it
Mm-hmm.
will make a difference in their outcome
Mm-hmm.
long term,
Mm-hmm.
and their mindset, their mental health, their
Mm-hmm.
physical health, and their quality of life. I think
Yeah.
it will make a difference, and so that's why this is so important to me. May I ask you a question back?
Of
Yes.
course.
Okay. So I think there's a stigma around the words palliative care. And I wonder if the waiting room revolution will help with that stigma, both at the individual level where people react to, oh my gosh, if I'm seeing palliative care, this is scary, but also at the systematic level where, there are certain jurisdictions where you can't see a palliative care doctor unless you can prove you're within, the last 3 months of your life or something like that. So,
Mm-hmm.
how can we break that stigma? And just again, do you think the waiting room revolution will help with that?
Oh my goodness, there's so much to say about
Yeah.
that to unpack. But this is what I'm going to react first, and Sammy might build on this. But I think the idea of we have been trying for over 2 decades, maybe and more, to try to say, get the public or even the health system to appreciate the language of palliative care. And I think what I've realized is that is not the patient and family's goal or job. What they want is person-centered care. They want to know what's
Mm.
happening and get that. So if we use different language like person-centered care or just the best care possible, or just so that you're more in control and choice, that is what a palliative care approach unlocks. But if we hide it behind that, then we are getting in trouble. So in a way, what we're trying to do with the revolution is to get people to feel and experience the benefits of a palliative care approach without calling it that, labeling it that. And then when they go to the system, they can leach it out of their neurologist, of their social worker,
Mhm.
even though the social worker may not even realize that that is a part of a palliative approach. Good information, helping people be prepared, understand what's happening, appreciating and validating the work of the community, and customizing their care plan to their needs. That is what a palliative care approach does, and
Mhm.
that doesn't need to happen under some regulation. So I think we're trying to spread the philosophy, well, maybe not the philosophy, but the benefits of it without the labels. And so I guess in a way
Mhm.
I'm sort of sidestepping it. Like I don't think the primary goal has to be that everyone appreciates that they're getting this from a palliative care approach. It's we care more that they're getting the benefits of it. I don't know,
Mhm.
Sammy, what do you think?
I just think that, like you said, we have spent so much time trying to untangle this word palliative and what it means and what it doesn't mean. And it's loaded. And we can continue to have those discussions at every level. But I think of Nike, I think of just do it. Like we have got to get beyond those conversations. Should we call it palliative care? Should we not? And we need to just make sure people are getting it, which is what you described, Cian. Very um, humanized, person-centered, information sharing type care, what that acknowledges the family as part of the unit of care, that it is peppered into the entire illness journey and shouldn't wait for a specialty team to just be available near the end. This has to be part of the care cadence from day one. And so I guess so to answer your question, Kathy, Sienna and I were so frustrated. We decided to okay, abort those discussions. Let's just do it. Let's just put
Mhm.
another face on it and make sure patients and families can extract it from an uncomfortable healthcare system.
And I think
Yeah.
inadvertently that will reduce the stigma because now
Yeah,
when they say, well, this is a palliative approach to care, it's sort of like once they've gotten all the benefits, they can go, oh, you're calling that a palliative care approach? Well, I want that. And
yeah.
how come you're saying I can't get that yet? Or if I can't get it from a specialist, can I get it from you? And the answer is yes. Every
Mm-hmm,
healthcare provider
mm-hmm,
is responsible. And frankly, all the community supports programs are trying to provide a palliative approach to care. They are.
Mhm.
Just
mm-hmm,
they just may not label it that because of, these
mm-hmm.
outdated models. So does that answer your question?
Yes, very much so. Thank you.
Yeah, I mean, there is one more thing I wanted to talk a little bit about is, our book was the start, obviously our podcast, and it isn't about us, as we say, it's a revolution. It requires, just like
Mm-hmm,
ALS has done with the Iceberg Challenge and others, it really is a
mm-hmm,
community movement. So I think there's a lot of alignment, but we
mm-hmm,
are working on a workbook, which, we call it a workshop in a box, but we are hoping that, the Alliance and, ALS Canada, but if we can produce sort of a package to make it easier for sort of training in the community for the amazing support programs, but also this is the education part of that. And I wondered what you thought of that model, if that would be applicable, because obviously we started with the book and the reception has been great, but we've realized we need more practical
mm-hmm,
parts to it. So the workbook accompanies it, and then sort of facilitator material so that the ALS community coordinators can or
mm-hmm,
educators can have something so to help patients and families get this information sooner.
mm-hmm.
What do you think?
So I love that approach, and I'll just digress for a little minute. The last 2 years, the Alliance has been working on a similar program, but in a different vein, called Breaking the News, and it's a communications
Mhm,
protocol that has been developed by some fantastic faculty,
mhm,
and we use it as a training program worldwide for helping clinicians learn the skill of communicating the diagnosis of ALS with empathy and compassion. And so there's a specific protocol that's followed in that program. And so we developed that program in 2023. We disseminated it starting in December 2023, and we've had that program delivered, as I say, all over the world. And so it's a model that we're going to follow for other educational programs as well, where we want to influence change with primary care physicians, with neurologists, with specialty neurologists, with allied health professionals, social workers, and PTs and OTs, and so on, that all work in the multidisciplinary team. So we're working on another program right now on early diagnosis, as I said earlier, and we'll follow that same model of developing educational models, train the trainer, facilitator, workbooks, and so on, and disseminate that globally. But we believe very much at the Alliance that we don't have to be the authors of everything. We want to avoid duplication, and our real role is to enable global collaboration. So if you're developing something like this, we'll be behind you 100%, and happy to help disseminate it outside of the Canadian borders. And because embedding palliative care principles, and even if they're not called that, is something that can benefit anyone, anywhere in the world, in the ALS MND community. So happy to help in any way that we can with your workshop in a box, and you just let us know how we can support you to get that out there, because I think it'll be fantastic.
Okay, I want to now deem you commander of the revolution. Okay, so not just a member. You're a
I am a
commander
mere
in...
member. It's a team effort, and it's going to take a huge team to conquer the
Yes.
world with this.
Yeah.
I just want to give a shout out because we at ALS Canada and the International Alliance have been early adopters of this, and we've partnered on a project called the Roadmap Project, where we're trying to create a simple one pager that would help maybe patients and families might find early, feel comfortable, ask some questions, but also then find the amazing resources that are in their local organizations sooner. And I don't know if you have any comments about that, but we appreciate that ALS, MND, they're very heterogeneous, and so our typical story of zooming out, where there's a beginning, middle, late, and end stage, there's this pattern, that language may not apply, but I still think there's a role for people recognizing that symptoms are progressing and that there may be some milestones, or at least asking, does this change in my symptoms mean I'm progressing? And what does that mean for what to prepare for? And that's really the goal of what this is for people to know that there is a progression or advancement. But what are your thoughts on that? Do you think like this idea of a roadmap or some sort of these tools early on might be helpful?
I definitely think the tools will be helpful. And I do agree with what you said about the difficulty of saying, beginning, middle, late stages. I'm normally one who likes to categorize things into boxes, but in the ALS world, because of the variability, it's very difficult to be able to do that. But I think if you do take a symptoms approach and say exactly what you just said, Sian, in terms of, my symptoms are progressing and they started in X way, and now they're in a different way, now they're Y. What does that mean for me? At least arming people with the questions that they need to ask at those inflection points will be super helpful to people, because, again, I know I'm only an N of one, but my experience with my journey was that when I asked my friend who was a palliative care nurse at certain points, certain questions, she gave me the questions that I needed to ask for the next few months. And so providing a toolkit to people that are just starting out on this, stepping onto the conveyor belt, as you called it earlier, will be so helpful. So I'm again, totally supportive of a toolkit, a roadmap.
Yeah. Many people that I meet, when they go to the clinic, they get, a thorough assessment in terms of their strength and sometimes their lung function, and of course, swallowing, and et cetera, et cetera. And they're given information, your strength is now this or that, but they don't realize that they can ask for the meaning behind that. Like, what does that actually mean that my,
Hmm.
my pulmonary function, my lung function has gone from this to that. Like, I get that those are two numbers and that one sounds like it's worse, but what does it mean? And
Hmm.
Yeah.
so I think it's this idea of, when in the busyness of clinics, we follow up on these things, but we don't put it in perspective for
Yeah.
people, in terms of what does it actually tell? What does it say about this ALS story?
Yeah.
Hmm.
The zoom out part.
Hmm.
Kathy, it has been an amazing conversation. We are almost at the end of time. I want to end with a question about looking back, what are you most proud of in your
Mhm.
work with
Oh,
the International Alliance? I feel like
oh, that's
we don't give ourselves credit enough. So I want to give you a chance to talk
uh,
about something that you feel proud that either the Alliance has done or that you personally feel that you can look back and give yourself a moment here.
there is so much that I'm proud of with the International Alliance. It's going to be hard to say it in just a couple of minutes, but um, we I think at the International Alliance, we're a very small team and a small budget organization, but we have huge global reach and huge impact.
Mm,
And that's why I'm so proud of the team at the Alliance. And we do have such high global impact because we have an army of volunteers.
mhm,
And so we literally have hundreds of volunteers who do the work of the Alliance to enable global collaboration. And I particularly have a lot of gratitude to the people living with ALS who not only face day to day challenges in their home life of living with ALS, but they give of themselves to the international community as volunteers, which on top of living with ALS is a huge give to the whole world. And I think universally, those individuals are so phenomenal because they're really putting the future people with ALS first, over and above themselves. And so, things that I'm proud of very specifically with the Alliance. Um, we introduced a fundamental rights survey in 2021 and we redid it in 2023. And the data from that, we're a very data rich organization
mhm,
because the fundamental rights are aspirational for our community. So there are
mhm,
things like everyone living with ALS should have access to the highest quality healthcare.
mhm,
Everyone living with ALS should have access to genetic counseling and testing. And so
mhm,
within each of those fundamental rights, having the survey data to say what's happening globally
mhm,
around each of those things is so powerful and meaningful because that's when we can start to move the needle. Like we
mhm,
know, for example, that our understanding of genetics is going to make a big difference in terms of ALS, MND, but genetic counseling and testing is only available in about 30 countries in the world.
mhm,
Mhm.
And so, those are the kinds of things that I'm super proud of is
mhm,
that we're moving the needle on access to care, access to treatments, access to um, uh, remuneration and advocacy and genetic counseling and testing and so on. But I
mhm.
honestly, I could go on forever about the
Yes.
International Alliance.
Yeah.
So I'll stop there.
Yeah, I mean, there's an ALS revolution happening, right? And it's being
Yeah.
led by the Alliance, so it's amazing.
Mhm,
Kathy, thank you so much for joining us
mhm,
today and for your support. And we love talking to you and getting to know you better.
mhm.
Thank
Thank
you.
you. Yeah. Amazing.
Hey, thanks for listening. Don't forget to rate, review, and subscribe if you haven't already. Visit our website, waitingroomrevolution.com, for more information, to join our newsletter, and to check out our book, Hope for the Best, Plan for the Rest. This podcast is produced by myself, Kayla McMillan, Shilpa Jyothi Kumar, and Maggie Sivat. And our theme music is Maypole by Ketsa.